Thank you very much. So it's my pleasure to welcome Ronita. In fact, it's my pleasure to meet her for the first time in person, since we've been working together since Christmas last year, I think, on a big grant to do some work in Singapore and study upstream determinants of health behaviors, for example.
Yes.
So Ronita is an architect and she knows about the built environment. She's an associate professor and her group is called, what is it called?
Sustainable Design Group.
Sustainable Design Group. If you want to get funded, you have to have sustainable in your name, because that's the name of the game.
Yeah.
All right. So I'll hand you over to you to look forward to as well.
Thank you so much, Soren. And yes, it's also a pleasure meeting you for the first time in person. Now we all know how we look like. So thank you so much for giving this opportunity to share my work with a group who I would aspire to work with a lot, because I'm not a medic, neither trained in epidemiology, but the work I do has huge amount of correlations to health, and my endeavor is to develop the correlations and develop the relations to work collaboratively. So a very brief discussion of what exactly I do. So you'll find me installing sensors across buildings, across built environments. I also do a lot of experimental modeling, and where you can see here a little bit of airflow modeling happening. And apart from that, I also collect a lot of data from people as occupants about their practices, about their perceptions of health, about their well-being. I mainly work on health, like incidence of disease, rather than well-being as an indicator, but I'll also share a little bit of my work on that. So when I say I work with this, I combine all of these sort of data to respond to our urgent goals of climate and efficiency, energy efficiency that we require, as and when we are also responding to occupant well-being. So when I talk about data, I basically use a whole lot of data in terms of which can be both quantitative and qualitative, and sometimes very innovative forms like films and TikTok videos are also a part of my data set. So that's where I try to convert design into policy framework. And that brings me to my research group, which is a sustainable design group, where we work on these 4 verticals of sustainable development goals of health, energy, a little bit on gender equality, and overall on the sustainability of built environments. And this is what our group's mission. We also have few members here and few members joining online, where we work on the 3 nodes of the triangle, which most of our works either have, at least have the 2 nodes, where we combine these to develop sustainable design. And by sustainable, we also mean it's a healthy built environment that we are designing. Given that I see design as a solution, so most of it, and when I look at data, I'm trying to look at outliers rather than the normal curve. So by that, I basically want to see why does an outlier exist in that particular pattern. So I'm more interested in looking at data which exist in isolation within a different pattern in a neighborhood. So broadly, these are the keywords you'll find in all my publications. So talking about urbanization tensions, that's where the whole stem of sustainability research comes in. We need to have a huge amount of shelter housing that will come up in the next decade, and a large amount of built environment will be coming up. As per UN, 3 billion people will require affordable housing and better built environment. That has connotations to energy and health, but however, we can use these feedback loops to generate better design so that they have positive impacts on health. So we're going to do a very small little poll here. I'm just trying to find out how do I get to the poll.
Thank you.
Yeah.
There it is.
And I launch it. And here also, so the question is, guess the distance between, to move it. So if you are standing in front of King's College, exactly where the photograph is, and you have to guess the distance with the Bolt brothers and with the Fitzwilliams, Cambridge. So first, let's guess the distance between King's College and Fitzwilliams. How many of you think it's half a kilometer?
Which branch of Fitzwilliams?
One just down the road.
One just down the road, yes.
Okay, on Trumpington Lane.
I launch the poll so people can vote and we'll be able to see. Once you can, I've launched the poll so you can now vote. If you think the distance to Fitzwillies is 0.5 kilometer, vote for it. And we'll do it for up to more than at least another 15 seconds, and then we can stop it. Any guesses from this room? Whoever feels Fitzwillies is 0.5 kilometer or more than a kilometer, 0.5 kilometer? About half. Everybody feels that? Is there anybody who feels the other way around? And what about the Bold Brothers coffee shop? It's near the Round Church. More than half.
More than half.
More than half. Okay. Okay, I'll end the poll here. So now we know I'll keep this. So there are people who feel so to give you the answer, both are at exactly same distance. One is at 0.5 kilometer, exactly 500 meters from the door of Waters Lodge of King's College. You will reach these two destinations. While majority of them feel it's 0.5 kilometer, which is a good perception, that means they know the city quite well. There is also a good percentage, which is like 30% of the population who voted, actually feels it's more than that. And if we see we have nearly similar amount of data, but this also tells that we walk whenever based on our perceptive distance rather than the distance that we actually measure in a map. And that brings me to work that we did. That brings me to a work that we did where we actually asked population about two very similar points. And then we found out people actually guess the distance before they start walking or they decide to walk on a particular street. And that estimation is actually not just a numerical estimation. They are estimating based on a wide range of variables that they are kind of taking into account. And if I have to group them together, majority is obviously 41% said or traffic related variables like it's very crowded or there's not a large amount of traffic. There is also quite a good high percentage, nearly 49% of the population felt variables were related to urban form. So that means the way the houses or the buildings or the road is laid out, or the trees or the water body is laid out, that helps us decide where we will walk. So whenever we are doing walkability research, we often lay a lot of emphasis on the hard infrastructure and also on distance. So we say 30-minute cities, or we say 1 kilometer, 15-minute cities. Wherever, when we actually see where people choose to walk, it's probably not the distance, it's probably what's lying ahead. So when we look at desirability to walk, we see these kind of variables coming up a lot in our, I don't know, it's just, it's not working. No, it's not working. But however, imagine it's the same road with similar amount of walkability, width of the walkable space and quality of walkable space. We have two similar roads. However, what they differ is that they differ in what lies on that road. The physical infrastructure in terms of urban form or urban structures or the buildings, if I may say. So there is definitely, climate plays a very important role, whether you decide to walk or not. Other part is culture. So culturally, multiple cities have shown that it's the culture of walking that makes people choose to walk in a particular street or not. So and that's why we started looking at, does image of a city, of a particular street, or the location, or the climate, or the culture, or history makes them walk more rather than, or choose to walk more. So what we did was we chose a city where 31% population actually walk to most of their destination, and only 2% of the population use car. that kind of comes up with the question. So what we did was we selected 8 different places in the city where of different sorts of walkability around, in the sense that we started looking at very qualitative indicators. And we did a very mass survey. It was a very large survey data set where we asked people, all the orange color is walking. So we collected videographic evidence of how many people were actually walking there versus, and we converted them into a very quantitative ranking. And all the other colors that you see is based on the particular liveliness, chaotic or boring. And there are 2 streets which you see here, which starts with G, Garyahat and Garyahat, and look at Bara Bazar. So these 2 streets, when we looked at them, one street definitely scored much higher in terms of liveliness, whereas the other street scored quite less, where their walkability was quite similar. That means large number of people were actually walking. And then we looked at, we had actually a range of these sort of intangible emotions that get evoked when people walk on the streets. And we found chaotic and boring. From this, we formulated a concept that it's actually a combination of urban form, personal characteristic, interaction, amount of social interaction that they can have with the surrounding to develop this walkability. And we developed this hypothesis that if this is a street is walkable if it is more vibrant. So we developed a variable called vibrant, which we converted into 3 different parts. It comes from stillness, vibrancy, and chaos. And it is directly borrowed from the Brownian motion theory, where we see how many people are actually walking on a street and how many interactions you're having. And we tested that using those 8 streets. So we started yeah, that's fine. So we tested that, and we, based on our videographic evidence and based on our attractive points that why people would walk on a street, in a moment we will see small little people coming out. So that's the origin of the agents. And then each of these buildings are attracting points. So some are coffee shops, some are, so these attracting possibilities were derived from our survey data. And then we classified the streets based on their vibrancy and their probability of walking. And we saw that it actually fits our model, where we found out there are some streets which was basically these streets along these lines, which were very still, where walkability was lower and the probability of walking also was relatively lower. Whereas in some streets, which is the Garyahat and the Bara Bazar, which I showed, people did not find it pleasant to walk on those streets. So it gives an emotion that people walk on those streets because there is no availability of any other means of transport, because everybody chose, if there was another availability of means of transport, they would have chosen the alternative. Whereas in Garyahat, people actually get down from their cars and actually walk on the streets because of the vibrancy or the amount of attraction points that they get or the diversity that they get in those streets. That brings us to a question where in a setting where there is each of these urban forms have a different thermal signature, can we actually understand, does heat affects their walkability? So we started looking at urban form from a very broad perspective, from a satellite image, and we see here in a city where 3 different typologies of built forms are very closely associated to each other. And our endeavor was to find out the unique heat signatures of these 3 places. That brought us to develop a multiple matrix statistic analysis, and we developed this to be where we could significantly segregate the urban forms based on their heat signatures. We did that using a machine learning. We developed a machine learning framework where we could use all of these. So today we had 7 of these channels of information. You can actually add more, and you can, and we could successfully segregate these forms. And these forms had very different signatures of temperature. And I will show you how they look like. Then, so on top, these are the footprints. This is how they look like from on a Google Earth image, and this is how they actually look like if you're standing in front of them. That brings us, so we installed sensors, and that brought us to a very large data set. So we installed sensors for a longer time for correcting for seasonal differences, local weather conditions, and got the microclimate. Our endeavor was to find out, is there a particular form in a city which allows to cool down faster? Because every form is going to heat up. It's a city where a lot of construction is going on. So is there a form which cools down faster? So any point below the red line is actually thermally comfortable, whereas any point above the red line is thermally uncomfortable. We wanted to see if below the red line, then the curve has a larger area or it is longer. So you see a particular form keeps cool downs from 6 o'clock to 10 o'clock in the morning, which is the top form, whereas the other form had a cooling effect for a shorter duration. So that means it actually is more warmer during the day to walk on those streets, whereas it also have a connotation of whether people would choose to walk on the streets. And when we related this data to our walkability, we actually found out that particular form which cools down faster had more people registering to walk or willing to walk on the streets. This is just a snapshot of what people thought we were installing bombs in the city, and we got featured in the news. So when we looked at the temperature, the cooling potential on the humidex, there was one particular form that was coming up emerging out quite significantly, which had very high temperature, had the highest, it would be low cooling potential, humidex was very high, and the overall heat risk index was very, very high. Why does this becomes important? Because moving down the line, large number of population, large number of cities will have these sort of forms, which we just now saw had a high heat stress index, because they are the affordable housing that are coming up across the global south. And that's where the future of urbanites will be living. So what are they basically doing? They're basically going high rise, freeing up the land space and building more high rises. So we started looking at the work across the global south. These are the 4 cities that we have worked on. Today I'm going to share the Mumbai study. This is how it looks like. So they are going to replace all these high heat risk spaces with the highest heat risk space that we just now saw. So this is how it looks like. So throughout the city, you will have these sort of built environment coming up in extreme numbers, nearly to the extent that more than 50% of the population will be living in more than 50% of the population is currently or will be living in these sort of spaces. So that means if these houses are not actually responding to the climate burden, they have a pathway towards health impacts. And how does this work? It started, so you can see it started in 1995, where they cleared a part of the slum area and then started building. So if I show you in picture, this was a picture in 2018, where you see the small little building in the middle, that's where the people will be transported before the building that's on the back, the tall tower, is being constructed. And once that is constructed, the rest of the land that gets freed, which is here, will be used by the developer to build extremely high-end residential buildings, which have prices or costs quarter to quarter comparable to London or New York in Mumbai. So it's bought by very rich population. So that's how they are cross-subsidizing and building these sort of houses. That brings us to the question. So this is how it looks like in 2021. And this year, August, I went, and this is how it looks like. So the high-end residential is built. The people have actually moved in. And so you can see the small little building, which was a transit building, is now kind of dismantled and people have started. This living in these houses we started trying to uncover what is the health impact of living in these sort of houses. This is a new policy that has come up, which is being copied across the global south because of its huge potential to close the housing deficit. And what are they doing is they are basically, so in a normal building, if I explain this graph, in a normal building code, they allow for the 45-degree angle. That means no building should cross the 45-degree line. Whereas for a high-rise building, the maximum you can go is 63.5-degree line. Beyond that, you cannot, the law doesn't allow. For these special buildings, they have a special code, which means they can, so now if you see, they have not mentioned any sort of height or angle restriction. They have said the distance between the building has to be minimum 3 meters. So there's no limit of what should be the maximum. But when you give a developer a minimum guideline, of course, the person is following a minimum guideline. And this is how it looks like in reality. It's a unit space of 25 square meter unit, and they are built in mass across. So you can imagine when the developer went for building permit, this brown space where a lot of cars are parked was actually painted green in color. And it was shown as like a Central Park New York space. So of course, huge health benefits from the green that will never be built or maintained. This is how it looks like in reality during a monsoon season. So these are just units stacked side by side. That brought us to understanding what does the inside and the outside looks like. And if you stand, this is a Google Earth image. So when you look from the top, it doesn't look very dissimilar to what they were living in, but it's just high rise. And if you just look up at the sky, this is the sky view, and it's very commonsensical what amount of daylight and ventilation, which has pathways to bacteria microbial growth can have. So this is how it looks like. So what we started with, so we had an original design was this. So when we started looking at it, I'll show you how it's not a storm blowing. It's just a video which was the speed was increased. So when an air flows, our endeavor is to bring in the natural ventilation on the leeward side, apart from on the windward side, because the windward side is getting the ventilation. You will see in a minute, all these units have the ventilation required, whereas these units do not get any sort of ventilation. So we changed that strategy, and so the image got reversed. That should be this. But you will see what we did was we introduced a sort of a fin here, which basically you'll see here, it basically drives the air up through this and then kind of turns it around. So these units, so in that image, of course, you're not seeing any ventilation in the windward side because we have closed the window there. But of course, if you're opening the window, you'll get the ventilation. So both the units started getting ventilation. One other problem we are now trying to solve, because they travel through the atrium and then go in, if the atrium is contaminated, you're going to breathe a contaminated air. So the natural ventilation, we are trying to solve that part now. At this point, so the problem also arises of how these buildings are actually looking like in reality. And this is how the windows look like. So when we talk to the architect says they are providing 1 meter by 1 meter window, whereas in reality, because of the lack of space and because of the huge family sizes, everything overflows into the corridor. So we started looking at from a design perspective, and this is when we started looking at the design burden of disease, and that's where. I'm sorry, I think I'm showing you a different picture. Anyways, that's where we started looking at 3 different designs, where one of the design was X type, and other was I'll explain it to you how it looks like. So the X type looks like this, where the central communication corridor is X, and you have 4 units on each of the wings, whereas the I type is a simple double loaded corridor, which we can see here. Whereas the H type is you actually get up and the corridor runs through the periphery, which brings us to, we wanted to understand what was the load of indoor air pollution there, because obviously, at that point in time, I couldn't do the microbial unit. However, we also later on got the data for tuberculosis, and I'll share that data in a minute. So what we did, we rented one of these apartments, set it up, we got all the data of how they live in these houses, and started doing a kind of a research on these sort of houses. So you can see this is our kitchen set. This is one of me trying to cook and emulate their lives. So we reached there. We kind of conducted these experiments for 5 days a week. We got the pollution data. So World Health Organization says that the kitchen area or the area where you're cooking should have a limit of around 25 microgram per meter cube. Whereas for India, they have changed it to a higher limit, which is 40. But when we looked at the H type, if you remember the H type design, it was on an ambient, it is 357 because outdoor pollution is also quite high in these cities. But when they cook using LPG or kerosene or even dirtier fuels, the the total concentration is around 2400 or even more. So, and then we basically converted into how many hours does it take to refresh air. So if I can give you a concept that if the age of the air in a room is almost around 2.5 hours. So one fresh air to get it exchanged, it takes around 2.5 hours. And most of the time, the women are actually closing their windows while they're cooking because the windows open to a public thoroughfare. So that's the limit they are getting. So it takes around 2.5 hours. So what is the connotation of this 2.5 hours is that because they cook for 4 times a day, each cooking time is 2.5 hours. Each cooking time is 1.5 hours. So by the time they stop cooking and then they start cooking, the pollution level doesn't go down. So if you just divide it into 4 times a day. So that means on a constant level, they are at a very high level of pollution. That brings me to, so we started looking at simulations of how can we change this in the resource constraint setting. So we looked at baseline and we started doing some kind of modeling of when they cook, what is the total pollution that is released. So we looked at various strategies. So first strategies, these are not costly. They just open the window constantly, not just during cooking. Second strategy was open during cooking, just the cooking. Third strategy, you relocate the windows to relocate the stove towards the window. So currently it's here and the windows are here. So if you relocate, what happens? And then also we eliminated all sorts of pollution sources like incense sticks or even mosquito repellent coils. And then did some more simulations on understanding what sort of interventions which require a bit of operational energy, which require no operational energy, but structural interventions like tightening the envelope so that the outdoor pollution doesn't kind of interfere with the indoor. Some green sinks so that the pollution is trapped, the outdoor doesn't come in. We also suggested a partition wall. So this is a small little partition wall that you can see here near the kitchen so that the pollution is restricted within the kitchen area and not spread throughout the multipurpose room where the rest of the members are also living. Tried with HEPA filters, tried with extract fans. So we said that nothing else, just install an extract fan. How does it perform? And also tried with some very high-end devices, which is not possible for these houses, but still wanted to see if the technology kind of provides. So how does it look like? It looks like something like this. So on an ambient level, the exposure is 891. This is an annual average. And when they are cooking with the windows closed case, it goes high by 88%. That means it's almost double the point. With just behavioral mechanism and opening the windows while cooking, they can reduce it to a level, but it's still higher than the ambient level. By just using the passive mechanisms and installing an HEPA filter, we could reduce it by 94%. Without anything, just installing an extract fan actually helped us reduce it to 98%. And that gave us quite a lot of hope because we could just go to the government and say, this is working with the government for this project where we could go back and say that, ask the developer to provide a extract fan. It's a very simple solution, but and it doesn't cost the developer at all. But however, currently some of the households have installed this and this is how it looks like. So what the 1 meter 1 by 1 meter window, which the architect always brags about, and it works if it's just an opening. But when you put a standardized window, which is 50% openable, which is a sliding window, so you compromise 50% of the ventilation there, then because the extract fan needs the pressure difference to work, otherwise it is going to bring in the air, not really throw the air out, they have to keep all the windows closed. So that there's a good level of pressure difference between indoor and the outdoor is high, and then it kind of comes out. So this doesn't work in the current context. So we kind of gave this as a solution to the policymaker. Then I was very interested to understand what is the health impacts. because I'm not a doctor, not that it falls under a remit. So we went and asked population, how many times do you visit a doctor? It is a very sensible question to ask in India, because in India, people do not go to a doctor until and unless they feel that they're going to die, because the do nothing scenario is very high. This is more because there is no government support to medical health. There's no insurance from the national insurance. So people generally do not visit a doctor. So, and only thing that changed for this population was they moved from the slums to these sort of houses. And so nothing changed. So their access to healthcare didn't change. Number of access to healthcare facilities didn't change. Their cost of living, their subsistence amount didn't change. So their income remains same. So nothing is changing. How many times did they visit the doctor was a good question to ask, just to understand whether they were falling sick or not. So we found out prior to moving here, a 6-member family, at least one member would visit a doctor in 3 months. Whereas after they moved in, every member, at least like in 3 months, at least every member have actually visited a doctor of a family. So it's almost 3 times the visit to a doctor, and that's what we are also seeing. We also wanted to see the asymmetry in where they're living. So is the concentration of visiting to the doctors is highest in the ground floor, or is the top floor, or is there asymmetry at all? We did find out. So if you see the x-axis means the age of the air. So how stale the air is. So longer it is, it's staler. The colors show where the floor is, and the cross point shows how many times each of these units visited a doctor. And it was very clear from this, the ground floor, and to some extent, some of the units in the first floor were actually visiting the doctor more times than the people who are living in the upper floors, which is also commonsensical given that the distance between the building is so less. That's when I got to work with a very large tuberculosis data of all the people living in these X type, I type, and H type, and the total sample size was also very high because there are around 5,000 housing units in each of these types. So we had the whole data set of number of people actually visiting the doctors, and this becomes very, very important because we wanted to see whether they developed tuberculosis after they came here, or they had tuberculosis before. So first of all, the number of incidences in the I type, H type, and X type, we saw that X and the H type were reporting 10% of the population were reporting incidence of tuberculosis, whereas in the I type it was only 1%. And it's important because in these tuberculosis is treated by the government, and if they are so that's why there's a regular surveillance by the health workers to each of these houses. They go and check whether there is some sort of marker for tuberculosis there. And so number of reporting is not really low in that sense. So if X type was reporting less than the H and the I type, it means that there is higher incidence. We also wanted to see whether the incidence was people who had tuberculosis before they moved in or after. When we saw the X type, most of the population were reporting tuberculosis within 6 months to 1 year after they moved in. So it might be a chance that they already had the disease when they were in the slums. Whereas when they moved in here, they kind of showed the symptoms and they were reported as an incidence. Whereas in the H type and I type, majority of the population who reported the incidence of tuberculosis had actually reported after living in these houses for 4 to 6 years. And that kind of says that probably housing design or the trapped pollution or the trapped, the growth of microbial in these, allowing the growth of microbial in these houses can lead to health burden, which probably is currently invisible or not even accounted for, because housing is not seen as a place where you can get tuberculosis. And even if you see tuberculosis research, I was not very aware of it until I started working on it. It's basically a male disease, and in India also followed the same trend. The number of male population in having tuberculosis were higher than the female. Of late in 2021, post-COVID, when they did the census again, in female population getting the disease has increased by almost very high percentage, around 22% higher, and the males had decreased. So that's for the first time, female and children are actually showing signs of tuberculosis or actually having tuberculosis. And also the second thing is tuberculosis is generally an outdoor disease because men work outside in congested environment, get the disease. This was for the first time. Women who do not leave their houses, they generally stay 99% or 95% of their time indoors. They were reporting tuberculosis. So this is a very new data set that is coming up, and we could kind of show the correlations. And this is what I'm showing you. The men dropped by 12% in 2021, where the notified cases for women increased by 7%. And in general, Mumbai, where these sort of houses are actually coming up, where more than 50% of the population will be living in these houses, they account for 30% of the total cases in India's total cases. So that's quite high even in numbers. And if this is going to be the future where people will live in, where larger population will get the disease, this is something of a matter of concern. So sorry. That brings me to the conclusion. We did find out the built environment designs can modify the health risk factors. Health outcomes can be mitigated, adopted through design. Technological solutions are needed and enforced through design, should be enforced through design standards. And finally, socio-cultural norms should be incorporated, like women not opening their windows during cooking is a socio-cultural norm which has to be broken through feedback surveys. And this is actually, I wanted to show you the picture here. This is actually us doing a feedback survey. And Larry, that's less there in the picture. Yeah. So when we showed this graph to the women, it became quite visible to them that this is why they cough after they reach the age of 40, because often they don't go and see a doctor because they have normalized coughing after a certain age. So women typically don't visit doctors at all. And when you normalize ill health, that's where the burden increases much more. So we do this feedback loops always before whenever we get our results, so that it kind of helps negotiating, increasing the negotiation power with the government. So as I was saying, sociocultural norms should be incorporated in health outcome assessments and policy design. And finally, if nothing works, I think always less is more. So just installing an extract fan actually solved the problem. And because I show these slides to the government, I also put this word as finally, if nothing works, just pray. And that brings to this is some of the work that actually came to light after it got a huge amount of coverage in the media, and the government were pushed back. So you can see in one of the newspaper, they said that researchers have said these houses are built for death, which is not something which I have said at all, but it actually sensitizes the government to take action into these settings. And this is a new form of research, I think, where we are connecting antibiotic resistant world with the built environment. And that brings to the end of the lecture. There's a lot of acknowledgements to all my people who have helped me work through this. Thank you so much.